I've had a lot of patients ask me recently about this injury to the Giants running back Cam Skattebo, which happened over the weekend, where he received a right ankle dislocation and fracture. So these injuries are quite common in these high contact sports like football. It's typically something that happens when the foot is implanted into the ground and the body is violently twisted one way, and through that force, the foot tends to turn underneath the ankle joint. And depending on which way the actual foot goes, it can either break the fibula, the tibia, which is the larger bone on the inner part of the ankle, the fibula being on the outer part, and it can break one or both of those type of bones. Now, these injuries are particularly very severe because a lot of times if there's a dislocation, the patient requires surgery, which usually entails plate screws, a cast, and typically a walking boot for a period of up to 10 to 12 weeks after surgery. So as you can imagine, that tends to lead to a player being out for the entire season. Other ankle injuries that we tend to see in the office tend to be sprains. A lot of these patients can be treated with just a walking boot for a period of 4 to 8 weeks, depending on the severity of the injury, and they follow up by a brace to stabilize the ankle joint that they can wear with a sneaker for another 4 to 6 weeks, even in bad situations. Injuries to the ankle tend to be a little bit longer in their healing process if it's a damage to a ligament. A lot of people don't believe that you're actually better off breaking a bone than you are tearing a ligament due to the lack of blood supply that ligaments have. Bones tend to heal very well, and there's a very scheduled healing process to ankle injuries if the bone is injured. Any fracture typically takes about 6 to 8 weeks to heal if there's little motion, meaning patients are in a walking boot or they're casted. In some instances, they have to have surgery. But when it comes to ankle ligament injuries, which can happen in the same mechanism that the fractures occur, can sometimes take 3 or 4 months to heal. Patients, unfortunately, limp on ankle injuries for a couple months before they seek treatment by one of the physicians. Unfortunately, this can lead to instability because the ligaments tend to heal, but they heal sort of with a weaker scar tissue formation in the area that replaces where the tear was in the first place, which typically is permanent. Now, patients can ultimately have surgery and have the ligament repaired. It's called a Brostrom procedure. There's a quite long recovery period of 8 to 12 weeks in a walking boot following that procedure.